friends, warm greetings from Dr. Rakesh and Homeopathy. Today I would like to talk about clinical training and importance of diagnosis for young homeopathic doctors. As we are all aware, knowledge of disease and its expression on the disease body in forms of symptoms is a very important thing for prescribing and the treatment of the patient. A myth and a belief that the knowledge of clinical medicine and the visit to OPD and IPD for the students of homeopathy is not required is absolutely wrong. As we are all aware, the homeopathic philosophy is based on symptomatology. What is this symptomatology? From where these symptoms appear? If you ask the simple question, symptoms are nothing but they are the expression of the disease body, and these symptoms needs to be recorded while we are seeing a patient or examining a patient. One hand, there is immense importance being given to the symptomatology, which is seen in the literature which is being read by all the homeopathic doctors. On the other hand, there is reluctance in understanding these symptoms, which can be learned from the disease body. Diagnosis helps us to understand the scope of homeopathy in treating such cases. It also helps us to understand whether the particular disease is within the domain of homeopathy, that is, whether it is curable or incurable. When we are processing the case, we come across something called as state of susceptibility. So from where this susceptibility can be learnt? The susceptibility can be learned from the disease phenomena, how the disease has progressed, how the disease has developed, and the duration of the disease, whether it is reversible, irreversible, and the diagnosis of the disease. So in short, the entire homeopathic management is based on the understanding of diagnosis, state of susceptibility, and what is the prognosis of the case. So now if I ask all my dear students from where this diagnosis can be learned, so the answer is only one. The diagnosis can be learned from the patient. And from where these patients are seen? Patients are seen in the hospital OPD and IPD. Dear friends, if I ask you, can a competent homeopathic doctor or a homeopathic professional be made without undergoing a tough training or without seeing a lot of patients or getting through a lot of exposure related to various disease conditions? So the answer is no. Similarly, Rome was not built in a day. There is a need for continuous training for all young homeopathic doctors to develop into accomplished OPD and IPD consultant. The word consultant has a great privilege, and with each privilege there is additional responsibility. So friends, please subject yourself for proper and perfect clinical training, attend your duties, attend your OPDs, and attend the IPDs for developing into a better professionals. Friends, we are all answerable for all human lives because each life matters. Wherever the art of medicine is loved, there is a love of humanity. This is a quote given by Hippocrates, and I hope each one of us stick to this quote. I would like to thank everyone and end my session.